Thanks, Rima. That was a fantastic discussion. So, everybody, we've had a lot to do over the last 2 days, and we're a few minutes away from the ending. I just wanted to say a couple of words, and then I'll turn it over to Peter. First thing, I simply wanted to thank a bunch of people. I want to thank Peter and the Microbial Threats Forum, all of the members for putting this together, and particularly the organizing committee. I think over the past 5 months, this group has put this agenda together, and it's been, I think, quite a nice discussion. I want to thank the speakers and the moderators and the panel members for, I think, some unusually thoughtful discussion over the past day and a half. And again, fantastic job. I want to thank Liana Woski and Elvis Garcia for so intently putting together the background paper, which I hope all of you have picked up now, but certainly take it home and read it. And then, of course, I want to thank Ceci and Ayano and An for, as I said last night, really being the engine and the transmission for the whole process. I think from the outset of planning for this meeting, the hope was to explore certain parts of preparedness, perhaps to a deeper level than is usual at many of these meetings. And in order to do that, we wanted to bring in a lot of the people who have actually dealt with the issues over the past many years, who have not just studied it, but really have been the people struggling on these issues. And so I hope you agree that I think that we succeeded in really exploring these issues to a good depth. As you know, I'm not going to try to summarize. I'm not that stupid. It'd be close, but I'm not going to try to do that. But I do want to leave you with a few reflections. I think the first one is that, it's clear over, many years that preparedness as a process has both a number of core aspects to it and then a number of evolving aspects to it. One of the core aspects, for example, is that if we're going to do this in some meaningful way, we have to be addressing both community needs, national needs, global needs, and perspectives. You can't do it on any single level. The second thing is that we do need to focus on, and we need to harmonize, but also make functional several different areas. And here, there are global governance issues, there are political attention issues, there are money issues, there are science and technology issues, there are operations on the ground issues, there are legal issues, and there are how to build and maintain trust issues. And so we talk about them, but the real issue is how do we act upon them? Now, out of necessity, a lot of the discussions and all of our work on preparedness is often specific and it's often focused. And it has to be that way because the overall charge is too complex. It's too big. It can't be swallowed in one whole. It has to be addressed in bits and pieces. And I think the other reality is that something as complex as preparedness is process of incremental gains. There is no home run which achieves what we want to do, and it's a process of continual incremental gains. But I think that there is always a danger of fragmentation. We may call it silos, we may call it fragmentation, but that is clear. And I think that we focused on vaccine for a couple of different reasons, but one of the reasons was to take something which is seen as relatively technical and relatively scientific, and to point out that, in fact, it is a very broad range of issues. And a lot of the less sexy aspects of it, the operations on the ground, the administrative bureaucratic processes, the liability issues, these were the issues that we stumbled upon. And as far as I can tell, they are where we are going to stumble again. Of course, there are issues about can we make a better vaccine, can we get to a universal vaccine, and so on. But we have to be equally attentive to these other issues. And so the bottom line point that I'm simply trying to say here is that while we focus on specific aspects, we do need to keep in mind that we're dealing with the elephant. We're not dealing with the tail or the trunk as the end goal. Now, the second point I want to make is that it's clear that despite the difficulty, some countries have gotten stronger. We heard directly from people from Mosaka from Liberia following Ebola. We heard from Abdullah Asiri about Kingdom of Saudi Arabia in response to MERS, and we heard from Gabriel Leung about Hong Kong post-SARS, and this is also true for mainland China. And I think the issue is that it is possible for other countries to get stronger, to get more prepared, to put in place what hopefully should be in place. But the key question for me is whether this is possible without repeatedly going through crises. Does every country have to go through a crisis to get there? It doesn't seem a particularly good way to make progress. But the answer may be that, yes, maybe that is what we'll have to do. You know, Peter Sands, I think, gave us a warning from behavioral economics. Be sober. You know, it's good to be optimistic, but be sober at the same time. But nonetheless, you know, we have to try. That's our mandate. We have to try. We have to sort of try to get past this. And so I think that, for me, again, one of the questions is, can we position preparedness so it is not seen as a response to an extraordinary and unusual situation? Can we somehow position it so it is seen to be something which is both desirable, but also something which is expected? And so it's what's expected for leadership to deliver. It's expected for what the bureaucracy should deliver. It's expected for what funders and technical organizations should deliver. And it's expected for what sectors, not just the health sectors, but the many sectors should deliver. And I think, again, can we get it to that position? Now, at the global level, there are several issues which have been raised and issues to consider, but I just want to highlight a couple of them. I think Peter Sands pointed out we should make use of the tools that we have available. SDGs, in a sense, are tools. I think Kumanan raised the issue of universal health coverage. It is a tool which can be used for these things, and we ought to use them. The second thing is that we need to make sure that the efforts to strengthen preparedness are not seen as isolated issues, but they are seen as part of contributing to a greater whole that is absolutely critical for the politics of making progress. But at the same time, we have to find ways to use those other capabilities and apply them to pandemic preparedness. So the issue of, can we use malaria capacities in terms of preparedness, and can we do this? And I think that both of those things are true. Another point that was made is that we need to support the international organizations. I mean, coming from WHO, of course, I want to highlight that organization, but it is not the only organization, and there should not be a disproportionate amount of attention placed to the importance of that organization. It is critical, but it is not the only game in town. Now, the other point I want to make at the global level is that we are faced with a situation where we're going to have to update how we achieve and maintain information and benefits sharing. That was the whole point of the PIP framework discussion. And it has to be done, again, in a way which is transparent and which is fair and which is understandable. I think that if we don't do that, we are really going to lose something that we gained. And so this is going to be a difficult concrete challenge, and I think that I hope the countries and member states engage with this during the Health Assembly this coming summer. Now, at the national level, at all levels, it's important to get the stakeholders to the table, but I think it's really, really critical at the national level, because at the national level is where much of the enabling actions are taken. And I think that at the national level, it's also important to focus attention on the level of countries that can actually act. In many respects, this is at the agency level. And so empowering the agencies to act, getting them to act, pushing them to act, getting the political leadership to recognize that this is where movement has to take care or occur is critical. The other point about countries is that governments really have to focus on building trust with communities. When you sit in Geneva at the global level, but when you sit anywhere and open up newspapers and watch the news, you see it permeated. Governments have to work on gaining the trust of their communities, or all of this is going to be very difficult to move on. Now, at the community level, so in terms of myself, I started at a kind of national level working at CDC, then went to WHO, and now am working at a community level in Hong Kong. But looking at that and also thinking back to some of the places I saw during West Africa, in West Africa as part of Ebola, as I think was mentioned by Amanda, communities in the local level is where the rubber meets the road. And the interesting thing about it is that being in, for example, Monrovia and talking with people from some of the slum communities, and talking with some of the leaders from churches and communities, but also being in Hong Kong and talking with people from different levels, the discussions are almost never about where is money. The discussions are, we know we need to do something, we want to do something, what is it that we're supposed to do? And it's really guidance. That is, communities are the energy supply of the world. The global level is not the energy supply. It's really at the community level. And what they're asking for, and what I think often that I hear is really, what is it that we should do? What's our role? How do we act? So I was going to end there, but I think I want to address one point raised by Kumanan, which is the tension. Is there a tension between the sort of vertical and the horizontal? And what it made me think and quickly realize is that I think the word coordinate is now a not irrelevant word, but I think the time for coordination is past. I think we've moved into an era in which the word cooperation works and coordination doesn't work. I'll tell you a little anecdote. The JEE process really started in South Africa at a meeting, and the reason why that process was even discussed and initiated was because one person in a room asked, "Are you going to coordinate us?" And the answer was, "No, we are going to work jointly together." And that was really the beginning of much of the thinking about the JEE process. And I think that at the global level, but I think at all levels, once you identify a goal that everybody can agree upon, you can generally get people to agree that they'll cooperate together, which is different than coordination. But I think it's a more sustainable, it's a more realistic way to approach these problems in our times. So anyways, with that, it was really a fabulous meeting. It was great to see so many old friends and colleagues here. I want to thank everybody for really participating in some great discussion. Thank you.
Well, KEIJI is a very humble and great diplomat, public health diplomat. So I'd like to thank you, KEIJI, for leading the charge in organising this fantastic two-day workshop and the public event beforehand, which didn't celebrate 100 years since 1918 flu, which a lot of other meetings have done, but learned from lessons and thought forwards to how we're going to deal with the future, and really thoughtful, really interesting. Now, I love the Forum on Microbial Threats. It's just a great institution. And I've been to many of these workshops, but I don't know if I've been to a workshop with 3 ambassadors, heads of agencies, former head of the National Academy of Medicine, and it's your personal persuasive capacities that brought everybody together. So thank you very much, KEIJI, for a brilliant workshop. And, you know, we talk about the peaks and the troughs and what are we going to do in this trough situation we're in right now? Well, one of the things we're doing, we are the resistance. The Forum on Microbial Threats will be here throughout the trough, dealing with these complex and difficult issues. And I want to talk about the next workshop, which will be, and for those of you who stayed late, this is why you get the reward of knowing the dates. June the 11th to 12th, 2019. We don't know exactly where yet. It could be in an even more exciting city in the Northeast, the capital of the free world, New York City. At least that's what they tell me it is, and I live there. But we're not sure exactly the venue, but please reserve the dates. We're going to tackle another very controversial and contentious issue, the role of microbes in chronic diseases, and really try to get to some understanding of what the basis that cuts across all the different hypothesized roles and proven roles will be. So it's going to be a very interesting, very informative workshop, and I look forward to attending, and I hope you're all going to come along as well. Just to finish up and let you know that the proceedings from this workshop will be published in 6 months or before, knowing the way that Cece and the staff work, probably before. And you'll be able to download videos of the presentations from the National Academy of Medicine website. So thank you all very much for coming. I really appreciate your attendance, and I hope you all had as great an experience as I did. Thank you.